So, Reese, in terms of the platform itself and the wearables that you've described, what types of data are you extracting, and how is it presented in order for those healthcare professionals to be able to take some action?
Yeah, excellent question again there. From the data point of view, it's completely dependent on the application we're actually doing. For what role is it for? Is this a social care role? Is this a care in the family role? Is this a care in the community role? Is this a care in the hospital role? But the beauty of again using Appian technology is it makes us agnostic to any sort of device out there. It's the Internet of Things. We've got a preferred wearable we use. We like working with Fitbit. It gives us good, consistent data points. Anything up to 120 data points with just the Fitbit alone. On top of that, then you can add in other sort of Internet of Things like specific blood pressure monitors, glucose monitors, drinking monitors. It's just your imagination is the limitation, really, of what you want to connect. What do I need to connect to make this person better? It is the ultimate answer to that, because there are so many things out there, and we can connect them all up now to the platform, collect the data, and share that data with whoever they want us to share that data with. Because that's the important question these days. Because this is the key thing for us, is we'll be able to allow us to for them to take personal responsibility for their health. Is that who cares for them? Where are their family? Where are their friends? And of course, if you look at the World Health Organization definition of the family, it's whoever loves for you. And generally those people aren't the ones who are living next door to you, on the same streets as you anymore. But they might be in Toronto, they might be in Sydney, they might be in London. It doesn't matter anymore. But what we do, we can share their health data with those people so that they can support them to live better. And you need that. You need that somebody poking you, going, "Oi, why aren't you out of bed yet? Oh, you haven't done your 8,000 steps, you haven't eaten and drunk today. Come on, what you doing? We all need those, because otherwise, we tend to go adrift, don't we? But having your friends and family involved in your own health and care, and yourself being involved in their health and care as well, actually is a great stimulus for us to live better. Because you've got to remember, a lot of people are living very lonely lives these days, and being lonely is, we know actually from the data, being lonely and living on your own is the equivalent of smoking 17 cigarettes a day. But all of a sudden, using technology, using our adaptable platform, linking into any device we want, and their friends and family, all of a sudden you're not alone. Somebody is looking over your shoulder. Somebody does care for you, and is nudging you, wanting you to be better. And this is what people need to be able to live a fruitful, confident life, so that they don't necessarily give up on life and end up in a care home. Because that's the necessary thing that usually happens, because they don't feel confident they can live at home on their own, and somebody's going to help them in time. But all of a sudden now, with technology, supportive technology in the community where they're from as well, it's like, carry on living at home. We will help you, kind of thing. And that gives them the confidence to carry on living at home, which it's so important. And this is what we've got. We're loving doing, because we're loving causing that change, for people to live better, more confident, in their own home.